Okay, good morning, everyone. Welcome to our final focus session for the semester, on focusing on the female reproductive system. After this, we just have the final exam. Um, I'll post a final exam review, similar to the focus sessions, just kind of covering a bunch of topics. But it's really going to cover a lot of the stuff that we focused on in the other focus sessions. So if you need more specific details, I would go back to the individual focus sessions to kind of prepare for the exam. Um, but like I said, I'll continue on here with the female reproductive system and I'll send something out later for the final exam. For this focus session, we're going to talk about anatomy physiology of the female reproductive system, and then two concepts that some students struggle with, oogenesis and then also the menstrual cycle. And then that'll wrap it up for this focus session. Excuse me. So female anatomy physiology, again, the functions of the female reproductive system are to mature and release the oocyte, produce sex hormones, primarily progesterone and estrogen, also provide nutrition for fetal development, and then give birth and nourish the infant. The primary organs are the ovaries, kind of similar to the male, where it's the testes. Essentially, it's the organ that produces the oocyte. And then secondary organs are anything that helps that oocyte make its way into the uterus, develop, and then help the female give birth. That includes the internal genitalia like the vagina, uterus, and uterine tubes, and external genitalia like the clitoris, the labias, and the accessory glands. Okay, so to start with ovaries and uterine. So both of these are part of the female reproductive system. They are two separate organs that sometimes are mixed and matched by students or by the general public. They are two separate things, but they do work together in tandem, especially when you look at the way the menstrual cycle works. The ovaries, their primary function is to protect and mature the oocytes, and they produce the female hormones, estrogen and progesterone. One thing to note is that fertilization does occur in the ampulla. That's a question I've seen on the exam before that I've seen students miss. Ampulla is typically right here. And then recall that the ovaries and the uterine are not connected to one another. The ovary will release the oocyte, and then the fimbriae will kind of pick it up um, with its little hair-like follicles, and it'll guide it into the ampulla, and it'll wait there until it's fertilized. Once it's fertilized, it'll then be released and make its way into the isthmus, and then eventually reach implantation inside the uterus, as you can see here on the left. Okay, so first of all is oogenesis. So where males will start producing sperm when they reach puberty, and they'll produce sperm cells basically late into the age, very late. Female females start producing their eggs um, while they're still in the womb. So what ends up happening is that meiosis one will start, and you'll basically start producing a primary oocyte. Um, but then it'll stop the process until you hit puberty. Once you hit puberty, the release of luteinizing hormone will trigger the primary oocyte to complete meiosis one, and it'll produce a secondary oocyte and a polar body, or the first polar body. One thing to note is that in the primary oocyte, recall that we have 23 pairs of chromosomes or 46 total chromosomes, and these chromosomes will determine a lot of our features like our height, our appearance, our hair color, eye color, um, our uh, our skin color. There's a lot of different things that these chromosomes will affect. But as a primary oocyte, you have 46. So the chromosomes have not split off yet in half. Recall that we need to have 23 coming from mom and 23 coming from dad to allow for the 23 pairs to come together and make the human being. Primary oocyte basically lines up these chromosomes into the 46 chromosomes lined up together, but it hasn't split them yet. So when you become a secondary oocyte, the luteinizing hormone will cause that splitting to occur, and you'll take 23 chromosomes in the secondary oocyte, and the first polar body will release 23 chromosomes, which are not used at all. And I'll have a better image of this in the next slide, because I think the next picture illustrates this a lot better than what I have here. Biggest thing to note is that the secondary oocyte um, will start meiosis 2, but it will not finish meiosis 2 until fertilization occurs. So the secondary oocyte gets released. You still have, and now you have 23 um, chromosomes lined up together, waiting to split off, but they have not split yet. And what happens is that secondary oocyte will then move into the ampulla. And when the sperm cell comes in with its 23 chromosomes, it'll release half of the 23 chromosomes in the ovum. And basically, it's like 23 chromosomes coming in, 23 chromosomes go out. At the very end of it, you have 23 from mom, 23 from dad coming together to make the 23 pairs or 46 chromosomes. And then once fertilization occurs, you can call the oocyte an ovum. And again, I'll show that here in the next slide. Um, the biggest thing to kind of understand here is that um, the female oocyte or the oocytes will kind of prepare themselves for division, but they will not divide until they are ready for um, basically for fertilization or for them to actually be released from the ovum. You can kind of see the numbers I threw in here. The biggest one to note, like I mentioned, is understanding that primary or meiosis one will start here as you're developing. You'll stop until you reach puberty, and then on puberty, you'll finish your meiosis one. You'll take the 46 chromosomes, cut them in half, so now you have 23 and 23. Then your second meiotic division begins. You'll ovulate. The secondary oocyte will then be will then get put into the ampulla. And then once the sperm cell brings in its 23 chromosomes, you'll develop a secondary polar body, and you'll lose 23 chromosomes from the mom side, but ultimately you end up with 23 from the mom, 23 from the dad, making 46 chromosomes or 23 pairs, and now you have an ovum or a zygote. If you're curious, if you want some more details, I'd go back and look at this in the notes. Most of the questions will come on the stuff I have on the left, the meiosis one, meiosis two, and kind of what happens to ultimately lead to the 46 chromosomes or 23 pairs here on step 6. Okay, the other one that we like to talk about here, excuse me, is the ovarian and uterine cycles. Um, these are two separate cycles, but they kind of work in tandem or in pair. So in the ovaries, you're going to have two different phases. You'll have the follicle phase or the follicular phase for the first 14 days. You'll then have ovulation occur, where that secondary oocyte gets released, and then you'll have the luteal phase. The luteal phase is basically named for the corpus luteum, which is this one here. And to kind of talk about how this works is you're going to have a trigger, or females will try to have a trigger every 28 days, roughly, um, where follicle stimulating hormone gets released, and it triggers the ovary to start producing, start developing the follicles. That's why that's a follicle stimulating hormone. Typically, about 20 to 25 follicles will start developing, and over the next 5 days or so, around day 5 or 6, one of the follicles will have developed more than the others. And so the body will then give all the nutrients to that one follicle to get it to reach ovulation. And then the other 19 to 24 follicles will drop off and they'll die off and get reabsorbed. Um, so this will start producing that one follicle all the way until it's ready to be released. And then you'll have a spike in luteinizing hormone, which triggers ovulation. That secondary, that follicle will then get released. And then what's left over becomes the corpus luteum. So things like a corpse. The corpse of the follicle was left behind. Corpus luteum will actually provide progesterone, which is required for the development of the fetus during the first trimester. In that time, your arteries, your veins, a bunch of other nutrition networks will start forming, and eventually the rest of the body, the female body, will then take over and provide those nutrients. But for the first trimester, the corpus luteum will provide primarily progesterone, but also other things that the ovum will need to survive while it's starting to develop. During this luteal phase, if a female is not pregnant, then essentially the corpus luteum has nothing to do and it'll start withering away corpus albicans, kind of here, see it pop off. And then when you have menses, basically it's just completely gone, it's reabsorbed into the body, and then you'll start the cycle over again. In the uterus, what happens is, again, you trigger menses, so you'll have a very thin wall, and so the female has shed her endometrium at this point. Over the course of the next 7 days, the endometrium will start reproducing and becoming more thick as it prepares for a potential fertilization event and implantation event. So again, the uterine cycle is split into two cycles. You have the proliferation phase, which is the development of the endometrium. And that typically takes about 14 days. Menstruation takes about 1 to 7 days or so. And then if you have a fertilization event, the uterine will start secreting to prepare for that implantation. And it makes it a very nice, hospitable environment for the newly fertilized egg to be implanted and then start developing. You can kind of see here, if a fertilization event occurs, then basically the secretory phase stays active and you don't lose your lining. If the female does not become pregnant, then over the course of the next couple of days, the corpus luteum will start degrading, which reduces progesterone levels, and this secretory phase is maintained by progesterone. So without progesterone, the uterine will start becoming less secretory and it'll start degrading, and then eventually you'll have a menses event where that endometrium gets shed and you'll start it over again. The way I've seen this question kind of been mentioned on the exams is you might be asked, like, if this is happening in the ovarian cycle, what should be happening in the uterine cycle or vice versa? You can also just be asked, as part of the menstrual cycle, what events are happening in both the uterine and the ovarian cycle? And you can kind of like put this together here. This is from your notes, but I think it's a very useful picture. It shows something very similar. I mentioned the follicle development here, where you have the follicular development, ovulation. You can kind of see that you've released the oocyte, and this piece that's left over then becomes the corpus luteum, and this will maintain progesterone levels until as long as a fertilization and implantation occurs. So woman gets pregnant, egg moves into, or the new egg gets moved into the uterine and it becomes implanted, then progesterone levels will stay high to make sure that the fetus develops properly. Without that implantation event, then the corpus luteum will start degrading, and you kind of see the progesterone levels drop off. Um, we mentioned that during ovulation, luteinizing hormone spikes up, but then kind of drops down to a normal low level. Um, and then follicle stimulating hormone, again, it's a decent level, but it will drop off and then eventually spike and drop back off again. It kind of follows, it kind of inversely goes with oh, luteinizing hormone. Um, but the whole idea of the follicle stimulating hormone is just to start this follicle development here. And so as it becomes more developed, you need less follicle stimulating hormone. And then you'll have a little bit of a spike during ovulation, but then it kind of drops off again before it raises. On the ovarian hormone side, estrogen, so follicle stimulating hormone triggers the release of estrogen and progesterone, primarily estrogen. So your estrogen levels will actually increase to help with this follicle development. What you see down here with inhibin is a hormone that reduces the amount that regulates follicle stimulating hormone. So, or it inhibits follicle stimulating hormone. So what will happen here is that as estrogen levels increase, um, it'll drop off after ovulation, and then you'll have the spike in progesterone, primarily from the corpus luteum. As long as you're pregnant, your estrogen levels will actually stay relatively low compared to your progesterone. And your inhibin will be high because it doesn't want you to make a new follicle. You're already pregnant. You don't need a new follicle. You don't need to be making a new baby. Um, But if you do not have an implantation event, you don't have fertilization, progesterone levels will drop, so does inhibin levels, and that triggers more follicle stimulating hormone to be produced so that you can start making more estrogen to start the cycle all over again. A lot of you kind of see how complicated the ovarian and uterine cycle can be. Um, the biggest things I would note is, when are estrogen levels high, when are progesterone levels high? Um, when is follicle stimulating high, a hormone high? When does luteinizing hormone get high? Those are the kind of questions that I would expect on the exam. Is just asking you like, hey, when should you expect to have high progesterone levels? And you'll say, oh, it's going to be the luteal phase of the ovarian cycle. Um, or you can say, hey, when do you expect follicle stimulating hormone to be at its highest? Well, it's going to be the start of the follicular phase of the ovarian cycle, that kind of thing. That's basically it. That's all I really had for this one. I just kind of wanted to talk through primarily the cycles, the menstrual cycle, and oogenesis. Um, Hopefully by now you've developed a bit of an understanding on it. Um, but it is one of the more complicated topics because there's a lot of stuff going on. Because you have two organs working together and you have a lot of hormones going back and forth to try to get this to create the perfect environment for a developing fetus. But again, that's all I have. Reach out if you have any questions. I'm not the best at the menstrual cycle, but I do have a general understanding of it. But if you are confused, I would definitely reach out to Dr. Curley um, before you take the exam, for sure. Okay, thank you very much. Enjoy the rest of your day and have a good week. Bye.